Greetings. My name is Dr. Heidi Crocker from Momma's Chiro, and we're here today to talk about the benefits of chiropractic care in women's health, how chiropractic care can support the body through the hormonal changes and musculoskeletal changes that happen throughout the woman's lifetime. We really want to educate women on how chiropractic care can support the hormonal shifts and fluctuations that occur throughout the lifetime, how chiropractic care can help nervous system regulation, and also musculoskeletal care, not only through the childbearing years, but also through the whole lifespan, including perimenopause and menopause. Again, I'm Dr. Heidi Crocker. I'm a chiropractor at Momma's Chiro. I work side by side with Dr. Aimee Vanderschelden, the founder of Momma's Chiro. And what we really want to talk about today is understanding estrogen's influence in the body, how perimenopause and menopause impact the nervous system and musculoskeletal system, how chiropractic care can support women's health. We also want to bring in the synergy between chiropractic care and the therapeutic application of yoga or movement therapy. As I mentioned, I am a chiropractor. I have been practicing for over 35 years. And during that time, I'm also a certified yoga therapist, and I've integrated yoga therapy and movement therapies into my patient care for over 35 years. In addition to that, I'm also an educator. I have a doctorate in education and have spent the past 20 years trying to approach the next generation of clinicians to look at our patients through that holistic lens of a whole person, patient-centered care. And that brings in not only what chiropractic care, what we can do for you, but teaching you what you can do for yourself. So let's first just talk about the role that estrogen plays in our body. So estrogen is the female hormone that is primarily manufactured in your ovaries. There is a small amount that comes from other parts of the body, but for the main purposes, it comes from the ovaries. Men have a little bit of estrogen too, but not quite as dominant as women. But what's interesting is that this estrogen plays a role on every body, every system in your body. It has a role in musculoskeletal health to maintain bone density and joint lubrication. It has a role in the nervous system, how it regulates your mood and your stress responses and your cognitive abilities. It has a role in cardiovascular health. So there's little receptor sites on our heart that are sitting there, and they're called estrogen receptor sites. And it's looking for this free-floating estrogen in our blood to attach into those receptor sites and help with the intensity and the frequency of a heart palpitation. It also impacts our digestive and metabolic rate, how much our gut motility and our fat distribution in our body. And it also has an influence on our postural stability and what's called proprioception, or where is your body in space as you move through the world. So Momma's Chiro has been founded and primarily focusing on the childbearing years, that perinatal care and the hormone changes that happen to the body and the influence that has during child rearing. And also, of course, the pediatrics, right? The little kiddos that come in the first couple of years of life. But what we're realizing is that once you're a mama, you're always a mama. And you have these hormones that fluctuate after childbearing years that still have an impact and play havoc on our systems. And we want to help you get through that period of life. So we're going to specifically talk here for a minute on how perimenopause and the actual stopping of production of estrogen at a moment in time called menopause changes some of the changes that happen in your body, specifically in the nervous system and the musculoskeletal system. So in the nervous system, and during perimenopause, there's a fluctuation of estrogen. It's not quite as much as it used to be during childbearing, but it's still being produced some months more than others, right? And that can affect your sleep, that can affect your cognitive function, and also your stress response. And that stress response is because that decrease or that fluctuation in estrogen increases the sympathetic nervous system activity. And that can create symptoms of anxiety, heart palpitations, as I mentioned just a few minutes ago, and reduced vagal tone. There is evidence to show that there is some links between these hormone shifts and individuals who are susceptible to migraines and headaches. So if you were someone who, during your pre-pubescent years or going through puberty, you suffered with migraine headaches, there is a chance, there is some evidence to indicate that there's a possibility you might experience migraines going through perimenopause. So at musculoskeletal system, as these fluctuations in hormones start to occur, they do influence the lubrication and the movement of our joints. And so our joints and our muscles start to become a little more stiff. And because they're stiff, the body responds by creating inflammation, right? That's a protective mechanism. And it also has some havoc on your bones, where it has an impact in the density of your bones, how strong your bones are. So we're actually at that loss of estrogen increases your risk of losing density in your bone. And the early stages, that's called osteopenia, and that can actually advance to what is known as osteoporosis. And those situations increase our risk for fracture. So we want to make sure we're working on balance, weight-bearing exercises to increase our bone density as much as we can. And it also has an impact on our postural changes because it can affect spinal alignment and, as we mentioned, the proprioception, where you are in space. So let's talk a little bit about this synergy between chiropractic and integrating movement therapy. And in this case, we're specifically talking about yoga, right? The therapeutic intervention of yoga. Because chiropractic, again, it's something that we are doing to your body. A chiropractor administers a chiropractic adjustment to your body, right? So it's something you're doing for yourself. We're doing it for you, to your body. And it optimizes spinal function. And just so happens that the spinal cord and all the peripheral spinal nerves come out of the spine. So it also serves to have nervous system regulation. These adjustments of the joints, the spine and other peripheral joints helps decrease joint stiffness, and it decreases the inflammation. And it can also help with postural issues and musculoskeletal imbalances, right? So it's something that you're doing to your body. Now, yoga therapy or the implementation of movement, breath work, and mindfulness or stillness of the mind, that's something you're doing with your body, right? And that's, again, supports bone density preservations by weight-bearing, load-bearing exercises. It can help prevent postural issues and musculoskeletal imbalances. But the most important things, it is a unique activity that you can do with your body that goes internally inside your four walls to focus on your mind. What are the thoughts? What are the monkey mind thoughts that are going on? How does my body feel? And with my mind and my body, how does my spirit feel? What is my purpose in life? Because as moms, as women, we tend to be the nurturers. And as those relationships change with our children, with our spouses, with our pets, with our family, our mothers, our sisters, our brothers, our world around us, as our relationships change, our spirit, our purpose in life needs to change. And we need to check in every once in a while. And that's where yoga can come in. So together, these things can really create a complementary approach to whole person's health. And here we see Dr. Aimee giving this, looks like a pregnant mommy, some stretches, some yoga stretches to really open up the front of the chest and open up the thoracic spine. And here on the right, I just wanted to show you, this is my friend, Rachel Krentzman, who is not only, she's a physical therapist, but she's also a mental health counselor. And she has written several books on yoga for spinal care, specifically focusing in on scoliosis. But she's written several on just spinal care and how important the spine is. And she is doing a pose here in this picture called tree pose. Dr. Aimee is doing a pose called mountain pose, and Rachel here in this picture is doing tree pose. So chiropractic and yoga, how do they come together? All right, we've already talked about them, putting them together. They improve joint mobility and spinal alignment. Chiropractic is doing it to you. Yoga is allowing you to do it with your body. Enhanced nervous system regulation. It reduces pain, tension, and inflammation. It supports posture, balance, and bone density. And it also promotes emotional resilience and hormonal adaptations because stress impacts hormones. So let's look at some targeted strategies here. Let's focus if we were talking about your complaint, your particular issue is joint and spinal mobility. Well, we would do chiropractic adjustments. We would align the cervical, thoracic, and lumbar spine so that they sit, that spinal alignment allows the body to function at its maximum. And we would also do some yoga poses. We would give you things that are specifically related to moving the joints a little bit more. But here's the key, the little added element that brings these two together, that helps create the environment of health, and that's nutritional support, right? So you have chiropractic done to you, you do yoga therapies with your body, and you put in your body healthy nutrients to support the needs of your system. The yoga poses we would do here and focusing on joint and spinal mobility, might be some gentle twists, might be what's called bridge pose for pelvic stability. There's another one called cat-cow for spinal flexibility. And we'll be creating some videos for some of these for you at a later date. Now, if our target here was not necessarily spinal joints mobility, but we're really looking at, we want to look at nervous system regulation, right? So if nervous system regulation, well, we're going to adjust you're going to get chiropractic adjustments because the vagus nerve stimulation increases the parasympathetic nervous system, then calming down so that the sympathetic nervous system, that fight or flight, is not in control. So that's really important. In the yoga therapy practices that we would focus on would be more breath related. How do you get oxygen to the muscles? How do you breathe in rhythm to slow and calm your body down? And once again, the link that binds these things together that makes your body complete is making sure that what you put in your body is nutritious and supports your needs. A third target strategy we might be looking at is bone and postural health, right? So if it's postural health we're really looking at, or maybe you're starting to get a lack of bone density, we are surely going to do chiropractic spinal correction adjustments to improve the weight distribution along your body. And in the yoga therapy practices we would focus on would be strengthening poses, things that are putting load-bearing exercises to help build that density back up. And once again, the most thing that links everything together to make that complete circle is the nutritional support that you put in your body. There is lots of evidence out here in the literature and even in articles that are out for public and the layperson conversation about the support of spinal manipulation and chiropractic in women's health. We have also yoga and the movement therapies and hormonal health. And there's actually articles written on the synergy between chiropractic and yoga therapy. And I have spoken on this topic at many conferences around the world. There's a link here. You should have a handout in your packet that is references for you to go and learn more. So the key takeaways today for women across the lifespan, not only perinatal during childbearing years, but also after childbearing years when you're transitioning from childbearing years going through perimenopause into the latest stage of life after menopause, chiropractic adjustments optimize spinal health and nervous system function. Yoga therapy enhances the mobility, helps with stress reduction and hormonal balance. Nutrition supports the healthy function of the body systems. So what you do to your body, with your body, and what you put in your body, together, they provide a holistic approach to women's health. So we have a call to action for you and for Dr. Aimee and myself to encourage women to integrate chiropractic, movement-based therapy, and nutrition into their life, to recommend daily self-care strategies with yoga techniques, movement, breath, and mindfulness, and to educate women on whole person approaches for hormonal and musculoskeletal health. So please reach out to us. Our contact information is here. I want to thank you very much, and we'll see you soon.